growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner here, and it is week 4 in our universal response as a dental industry reacting to COVID-19. And as you know, in the last month, I went in a different direction and didn't think it was appropriate anymore just to go on as if this wasn't happening and talk about the other issues I used to speak about, which I'm going to get back to. Those of you that haven't tuned in recently, I've been giving a series of what I call real-time responses from a clinician who absolutely is going to be back when it's over, just like you are. So, again, I hesitate to talk like that sometimes because I don't want to come off as too rah-rah with you. To me, this is real life, no fairy tale action as to what I'm doing to get through all this, because I'm positive I will be back in practice. And I do think that I will once again thrive. Not sure how quick that'll be, but it doesn't matter. I'm confident that I will push all the right buttons, and I'm confident that the advice I'm giving you is spot on. So, as you may remember from our last podcast, that I have done a couple of these webinars that a lot of people are doing for companies. And the one that I put together for the Washington State AGD, as I put it together, I kind of liked some of the things I was saying. So I wanted to share them with you privately on my own podcast. So if you reviewed last podcast, at the very end, I talked about, well, how much of it are we all in this together? Everybody gets those social media posts, we're all in this together. And we are. Most of us, not all of us. So I'll tell you what I did. I asked my team, I want you to know that the request was from my heart. It was never like, you need to do this or I'm going to remember that. It wasn't like that at all. It was like, listen, people are writing to me. I have a team of 20. If you have a team of 5, I don't hear from my whole team. I assure you I don't. I've heard from about 25% of my team. And I heard different things, but some of them say, is there anything I can do? And I said, yeah, there is something you can do. Let's have a reach out to our patient campaign. And what I mean by that, and it's in the last podcast at the end, is I have a number of people from their homes, staff members, calling patients, and I told you I'll send you the script that they're basically following. And the script says, basically, hi, this is such and such from Dr. Raz's office. We're just calling to say hi. We're thinking about you. We're not trying at this time to reschedule you or anything like that. We want you to know that you're on our mind. We're reaching out to you to let you know that we're thinking about you during these challenging times, and we'll be here ready to exceed whatever regulations that the ADA and the CBC institute, so you feel safe. And we will take your dental care at whatever pace you want us to take it at, as long as that's a responsible approach to what your specific needs are. And that's the calls we're making. I really believe that your patients are going to remember this. They are. And quite honestly, and I could be wrong. I absolutely could be wrong. But I think you tune into me because you trust me. And I see advice on you doing teledentistry right now, or how to capitalize on being able to go in for emergencies. I got to tell you, I couldn't be more opposed to that type of thinking. I'm telling you, people have been hurt by this, including us. I think it's a time to distinguish yourself from everyone else or not everyone else, but people that are out there trying to schedule discounted things right now, or take another doctor's patient as an emergency and assimilate him into your practice. That isn't what this is about right now. This is about an opportunity to be a real human being. We do dentistry, right? Our patients trust us and they come to us. I'm saying these 6 weeks or 8 weeks, whatever it's going to be, are not going to bury you. And it's going to be a time when your people, your patient family, can look back at you and remember that you called them and you said, hey, how you doing? That's all we're doing. We're keeping in touch with you. Is your family okay? Are you making it through? We know it's tough. We'll be here when you're not ready, and we're not going anywhere. And you'll be able to feel safe because Dr. Rasner is going to implement whatever protocols are required and above that. So there's no doubt in your mind that when you come in, we're ready to roll. And whatever we do with you will be governed by how comfortable you are, financially, mentally, whatever it takes. We'll get through this. That's the wrap right there. That's better than the letter I have. But if you want the letter, ask me and I'll email it to you. And just frame your own response. But that's the patient reach out program. And what else do I want to talk about? I'll talk about what CE training online should you be doing right now. I can tell you personally, I am looking up daily, no more than an hour, areas that I've always wanted to take time to improve in. So one area for me, suturing connective tissue grafts. An area for you, I'm a giant advocate of you getting your enteral sedation permit in your state or your country, your oral sedation permit. Well, some of those requirements usually are available for some of it for online training. So why not knock that out? That'd be awesome. That could be the best CE you could ever take right now online. Oral sedation training. But I'm also looking up things that, I was brought up, for example, on a soft shoulder 360 preparation of my restorations for full coverage crowns. And for the last 5 years, I've keep hearing and watching about the vertical prep. And to be honest with you, it's not something in certain cases, I'm a big fan of, but more importantly, it's my opportunity to delve into things that I didn't think I have a total grasp on. Or I'm looking up esoteric implant failure etiologies. So patients that are on serotonin uptake inhibitors, patients that are on drugs for rheumatoid arthritis, certain medications, when you have those unexpected rapid failures of your implants. It's something I never get around to. That's how I'm spending my CE online homeschool training, if you will. That's what I'm doing. What about when we open? So this is, again, a continuation of the podcast webinar live I've done from some organizations. And I want to bring it to you on my podcast because it's awesome information. I think. You'll have to decide. So what do we do when we open? Well, we're not open yet. And what I'm going to do is as follows. First, I'm going to communicate to my staff the truth. And the truth is, the goal is for me to resume a full team, a full staff, but I simply won't know if that requires a staged return of the team until we start making the first calls. I mean, what else could you possibly do? I don't know what's going to happen when we start making calls. Let's say I'm in the state of New Jersey in the United States. And right now I think we're shut down until May 10th. I'm not even sure, by the way. That's how confusing it is, because our governor came on television the other day and said he's extending it a month, but he didn't say from when. So let's say, for the sake of it, it's May 10th. Then I'll tell you that I'll reach out to my team the day I hear that. We will start making calls, and then I'll know what kind of team I will require back. And I will do everything I humanly can. I mean, I've got a long record, I think, as a owner of a business, of being incredibly benevolent and flexible with my team, whether it's when they're home with their children, when they have babies, when they want to take courses, even courses that may lead them out of dentistry. I've supported changing their schedules, which I would implore you to do. For example, I've had hygienists go back to college to become an accountant. So that meant I had to change their schedule while they were with me, knowing that they would not even end up with me. And I did that with one of my hygienists for 3 years because she went back part-time. And I had to be very flexible with her schedule. And she did get that degree. And she did leave me and then stayed in hygiene, by the way. So it doesn't always pay you. I don't do everything and not recommending you do everything because it's positively going to pay you dividends. Sometimes you just do it because that's what you want your MO to be as the owner of the business. That if you covet and respect an employee's contributions, then you will do as much as you can to be flexible. I've done it with a dental assistant that 3 months out of the year, and she wasn't even a primary or secondary level dental assistant, but she was good. And she wanted to coach soccer 3 months a year, maybe 4, which meant she had to leave 2 days a week during that time at 2 o'clock. Well, that's a problem. But I let her do it. And that's the kind of things I'm talking about. It's more likely that it'll be staff members that want to take courses, etc. But anyway, I think I tell you all that because when I put this program together for Washington AGD, I couldn't help but recognize that a lot of the things that I recommend to you, my colleagues, right now are the same things I've recommended all along to grow the business and expand your business without a pandemic reaction. They are the same principles. So that's my thoughts on communication. Again, I'm going to tell the staff as soon as I know we can that I will be daily in touch with them as to who I can bring back, and my goal is to bring everyone back. And if it's borderline, I'll bring you back. But you can't bring in, for example, I have 5 hygienists, which I think is going to be the most affected arena of our office. I think a lot of people may consider that elective. I'm not saying it's elective. I'm just telling you that's what I believe the response may be. So let me get to more specifics. Now you're open. Now part of being open is letting the patients know over the phone your new protocols on how they are to come into the office. And I don't want to take the time of this podcast because there's numerous sources for you to look into. There's a guy, and he doesn't even know I'm saying this, on Facebook named Ziv, Z-I-V, Simon, S-I-M-O-N. He's a periodontist in Beverly Hills, California. And he has a number of what I think are pretty nice, clear ideas. I mean, to me, it's intuitive and common sense. In the beginning, we're all going to have to, at this stage, I'm talking to you right now, on week 4, 3rd week of April, maybe they'll come up with the evolution of new testing that'll change what I'm about to tell you. But as I speak right now, I'm telling you our protocol is going to be what it was the day I went in for emergencies. And the patient would be questioned over the phone, the standard questions. Do they have a fever? Do they have any reason to believe they or anybody in their family has been exposed to a positive corona patient? They'll be brought into the office when the room is ready, I know this is complicated, man. Their temperature will be taken at the door. This is what we did. We had a little unit at the door with a thermometer. We had gloves and a mask for the patient, and sanitary hand wipes when they exit the office. And then somebody would lead them back into an operatory. Again, I'm just giving you the schematics of what you can expect. And the patients obviously have to be screened over the telephone, at least initially, until I hear a better alternative. And I'm confident that there will be 5-minute tests for your team and for the patient, if not already developed very shortly. That's clinically what's going to happen. In terms of your office, some just quick takeaways. I would be answering the phone on the second ring and no more. Listen, people's tensions are going to be up. And if they take the leap of faith that they want to go back into dentistry, you better be Johnny on the spot ready to make them feel it was a good choice to come back to you or choose you if they're a new patient. I'm telling you what I'm doing. My general philosophy is third ring, which reality is sometimes it gets answered on the third ring, sometimes it gets answered on the fourth ring. That was pre-pandemic. Now I'm telling you, I want my phone answered on the second ring. You better return the call if you don't have an answer within the hour. These are all protocols I had pre-pandemic. So there has to be a list of patients that call you that you don't have the answer to what your response is, and you need to call them back within the hour. And by the way, if now more than ever, and I had a slide like this in my presentation for the last 10 years, nobody wants to hear a tape machine. Nobody cares right now. This is my opinion. If you're dedicated to the patient in the chair right now, they maybe think that's a nice thing. They want a live human being to deal with whatever reason they called you. You can't go back in halfway. You're either in or you're not in. This is me. That's how I roll. That's how I think. So if I had to hire one of my staff members back to make sure the phones don't ring more than 2 rings, to give a human verbal response to that patient that wants to come back in to this business that I am not ready to give up, then that's going to happen. Also, make sure that you have pre-open team meetings. I can't tell you exactly how these are going to look physically. Maybe they're going to be done by phone. Maybe if you have the room, you can spread out your staff. Maybe there'll be tests in the next month that everybody can take to see if they've had the corona or, God forbid, if they have it. And you need to have clear, precise protocols on everything that I'm talking about right now. How you're going to look, how you're going to sound. Yeah, man, this is going to take some work. You can do it. I mean, you put 8 years of your life in this, and you're going to let this bring you down? I'm not letting it bring me down. I'm not. In fact, it makes me want to fight harder because I put so much into this up to this point. And I'm 65 years old. So you can find the energy if you're not. You can. So you're going to have these meetings. And I got to tell you, the number one thing that I want to leave you with this week is the thing I've been talking about for 1.5 years on these podcasts. About trust and confidence. Confidence that they're safe to come back to your office. So that's going to be based on somebody very eloquent on the telephone espousing the new protocols that you have implemented in your office to make them feel safe. And 2, that they can trust you on whatever you're providing and what you'll be recommending now more than ever. Listen, I am a full advocate of comprehensive examinations, and I'm not changing that. I'm not. And I don't think you should change it. But I am prepared, probably more than I have been in a long time, to have to come up with compromised treatment plans due to a financial limitation, be it temporary or for indefinite, for this patient that may not have had that limitation prior. So what does that literally mean? It might mean, unless it's impossible, a large filling restoration as opposed to a crown. Now don't read this wrong, because this is critical, and we're going to carry this into the next podcast as well. But I tell you, I won't hesitate to tell a patient if the right treatment based on what you're looking at is truly a crown. I assure you, my patients, and if you listen to me, your patients will know it's not based on the fact that you want a crown because it costs more than a composite. It's based on the fact that in this particular clinical situation, it's absolutely the right recommendation for them to do. But maybe you're going to have to do what I used to call put out the fire treatment plans. Like maybe you're not going to be able to be quite as comprehensive in what they'll accept pre-pandemic. I'm prepared for that, and it's going to be what it's going to be. I'm not going to go in, let me make it clear, and just start doing giant 6 surface fillings on everybody. I'm not going to ignore periodontal health at all. That's always been a staple, cornerstone of what I think protects my patients. So I see no reason for that to change at all. If they need soft tissue therapy, then they need soft tissue therapy. Maybe they're going to hold off on certain tooth replacement if they lose a tooth more than they would have pre-pandemic. You get me? That's what I'm talking about. I'm not changing. I'm going to do comprehensive exams still. They come in with a broken tooth, I'm looking at the 5 arenas that I've always looked at that are well documented in these podcasts. Go back and look. But I'm going to expound on this next week. But I think it's important for you to know that treatment planning, certainly initially, going forward, could look a little different. I think it could. And I'll close with this. I said this in the last podcast, and I want to say it again. I could have gone to work in the last month because the nucleus of my practice is big enough that it's a community. And in a community, there's different types of people, right? There are patients who wouldn't dream of coming in. And there are patients that are on the fence, and there are patients that would have came in and had full mouth reconstruction done because they think maybe their philosophy is that this is all hoax and this is all politically driven and conspiracy people. Listen, your practice is a community. That's why I always told you that it was beneficial for you to never have a my way or the highway. You do have to have lines in the sand that you will not cross. Meaning you're not going to do crowns on patients that have raging periodontal disease. I won't ever do that. I'd rather not have that patient. But maybe it's a patient that's got their perio under control, has a couple crowns done a year, maybe doesn't have all the teeth they need, so they don't have tooth replacement that they actually would be better off with. And sometimes that is a deal breaker because you have collapsed vertical dimensions and it requires you putting back teeth that they've lost. So I think we have a lot to talk about with regards to this, and I hope this helped a couple of you this week. Reach out to me at my email, Dr. Rasner, drrasner, @AOL.com. If you want any of the recommendations I've been offering you, the letter to your patients, the letter to your team, it's getting late on that one, and the verbiage for what we're saying to our patients, although I did it very well in this podcast, I thought, I'd gladly email it to you. Thanks for tuning in. See you next week.